Good evening, everyone. I see some participants starting to roll in this evening. I'm so happy to have Dr. David Putrino from the Icahn School of Medicine at Mount Sinai to discuss the topic recovery from complex chronic illness. Dr. Putrino is an official medical provider for Red Bull-sponsored athletes in North America. He's a physical therapist with a PhD in neuroscience. He's worked as a clinician in Australia, as you can hear by his accent, before moving to the United States to study computational neuroscience at the Harvard Medical School, MIT, and NYU. He served as a faculty member at the Weill-Cornell Medicine and Burke Medical Research Institute. He's currently the Director of Rehabilitation Innovation for the Mount Sinai Health System and a professor in the Department of Rehabilitation and Human Performance at the Icahn School of Medicine at Mount Sinai. He works to develop innovative technology solutions for individuals in need of better healthcare accessibility, which we will talk a little bit more about tonight. So, David, welcome.
Thank you so much for having me.
Of course, glad to have you with us. So I'll just start off with a couple of basic questions. The first is, as I briefly mentioned, you're currently looking into ways to help patients with complex chronic illness. Can you talk a little bit about what specific chronic illnesses you're currently looking into?
Yeah, it's a very exciting time for us. We're about a month away from the official opening of our new center at Mount Sinai, which is going to be named the Cohen Center for Recovery from Complex Chronic Illness. And we're focused on seeing patients with LongCovid, myalgic encephalomyelitis or chronic fatigue syndrome, chronic Lyme disease, and associated sort of joint hypermobility spectrum disorders. So people who might have hypermobile EDS or other forms of joint hypermobility.
Now, you're saying the center is newly opening. Are you planning to see patients regularly, or are you just planning to conduct research out of the center? What's your approach?
My role at Mount Sinai broadly is that I'm the Director of Rehabilitation Innovation. And so what that means is I sit within the Department of Rehabilitation and Human Performance, and I run 5 centers. Each center has its own clinical focus. But the main point of the centers is that we're really focused on trying to get new technologies and exciting approaches for treating patients from bench to bedside as quickly as humanly possible. So all of our centers tend to be hybrid clinical and research, but we will always, all of our centers are functioning clinics. We will see patients in a regular clinical setting, but we also have a little bit, I would say a closer relationship with research than most clinics do, in that we also have researchers working alongside clinicians and interacting with patients, asking patients questions, getting patients involved in the research process. So the short answer to your question is we will be functioning, like a regular clinic. People who just want to be seen clinically and don't want to be involved in research, absolutely fine, and that's what we do. And people who want the opportunity to be involved in different research projects can do that as well. We also, a big part of our passion is making sure that we, wherever possible, do things that are fully covered by insurance. And even when that's not possible, I'm sure everyone joining this webinar is aware of the fact that, for instance, some Lyme testing and blood testing often isn't available for insurance. What we tend to do is really take a hard line on working with the vendors to do everything possible to make it covered by insurance. So, which means interacting with the FDA, interacting with CMS, seeing what we need to do to get things over the line so that insurance will cover expensive testing that might lead to, meaningful treatment.
Now, Before I ask the next question, quick shameless plug of an upcoming webinar that Project Lyme has scheduled. The official date is not out yet, but we're going to be working with IGeneX to talk about their new FDA-approved fish test. As you talk about testing, Dr. Putrino, it is definitely a huge issue. So we're hoping with maybe new FDA approval, there might be some more buy-in from insurance providers that will allow patients to more easily have testing covered. But back to the point of this webinar and some of the things that you just mentioned, it sounds like, as you said, in addition to treating patients, you're also conducting research, which is really an amazing need for the community. Project Lyme recently promoted 2 of your studies. There's a 6-week in-person and an 8-week virtual. Would you mind talking about the focus of those 2 and maybe how people might be able to get involved?
Yeah, absolutely. So I'll start off with the in-person. And that is a really interesting clinical trial where I'm very excited about it because we're actually going to do a sort of a cross-condition clinical trial where we will be recruiting individuals with chronic Lyme disease. We'll be recruiting individuals with myalgic encephalomyelitis, and we'll be recruiting individuals with LongCovid. Some of you may be aware of some of the research that shows that people with LongCovid are more likely to experience things such as microclotting or formation of these fibrin bundles. Fibrin is this protein that sort of aggregates in our system when there's a lot of inflammation going on. And there's been some phenomenal work by an amazing researcher by the name of Riccia Pretorius out of South Africa showing that people with long COVID often experience increased clotting. Now, not clotting in terms of big clots that gum up large blood vessels, but more what we would call microclots, meaning these very small clots that may not cause, a serious medical event like a heart attack or a stroke, but are small enough that they can get into very small vessels and maybe cause reduced tissue perfusion and issues of that nature. And there is a compound called Lumrocaness, which is a natural supplement that can break down this protein fibrin naturally in the body and perhaps improve tissue perfusion and reduce the amount of microclots that are sort of circulating in the body. We have early evidence, anecdotal evidence from patients with long COVID to suggest that fibrinolytic enzymes like Lumrocanase and nattokinase are some that this community may have heard of, can reduce the number of microclots and make them feel better. So we wanted to put this to the test. So we're going to be running a clinical trial where people with long COVID, ME/CFS, and chronic Lyme all get the same microclot testing. They all get the same intervention. And we look at how it influences symptoms. And we're also going to look at how it influences any evidence that we can see of microclotting and platelet hyperactivation in the people taking the enzyme. Something that we're very excited about. We're very excited to finally do a good quality research study on this because, like I said, to date, all we have is anecdotal evidence. And so, really excited to get that one going. We're currently fully IRB approved. We're able to accept participants where the compound has just been shipped to us. It should arrive any day now. And so we're already starting to screen and baseline assess participants because we're confident that by the time we're through the first baseline assessments, we'll be able to provide the compound and see how we do. So I don't know if I want to just jump straight into the second trial or answer some questions here. Or, yeah.
So typically we'll keep the Q&A until the end. I think I was just going to follow up and say, I know you also have a virtual one that's a little bit longer and focuses on the use of a device. I would love for you to talk about that as well.
Absolutely. There's a company out there called Sana Health, SANA Health. And we've been collaborating with them on a clinical trial for a couple of years now. This device is a very interesting device that it basically looks like a sleep mask, and you pop this thing on your face, and it basically gives you auditory stimuli and visual stimuli. So you hear things, and you also see lights flashing in your eyes at a certain frequency. This is called audiovisual entrainment, and the theory behind it is that folks who are experiencing chronic neuropathic pain, so neuropathic pain is a specific sort of chronic pain where the pain signals are derived from misfiring nerves as opposed to active inflammation or an active injury. And so what we've seen in the past is that folks who have chronic neuropathic pain, we can see differences on their functional MRIs. We can see differences on their EEGs, their brain activity, that indicate that they have chronic neuropathic pain. The audiovisual entrainment strategy basically hits your visual system and your auditory system with a competing cortical input, which can change this pathological signal into something a little bit more removed from the pain signal that we've been seeing in other studies. So we completed a clinical trial with this technology and it was a placebo-controlled, double-blind, a randomized controlled trial, meaning neither the clinician evaluating the patient nor the patient themselves knew if they were in the placebo group or the active treatment group. And what we saw was the folks who received the active treatment experienced a significant reduction in their daily experience of chronic neuropathic pain. And that reduction was actually maintained at their 4-week follow-up after the end of the trial. So it was showing promising results in chronic neuropathic pain, and we know that folks who live with chronic Lyme disease often experience debilitating chronic neuropathic pain. So what we did was we reopened the study. We had actually closed the study, and we have already pre-printed the first results of this trial. And we reopened the study to actually focus specifically on people with chronic Lyme disease and chronic neuropathic pain. The great thing about this particular clinical trial is that anyone anywhere in the nation can participate because we can ship you out the device, and the outcome measures are questionnaires about pain levels. So it's very easy for us to administer that over the internet. So all in all, it's a great trial. It's pretty low burden, and we're very much looking forward to it.
Yeah, that's really amazing, especially to your point, the essentially nationwide accessibility of it, I think is really cool, especially within Project Lyme's network. I know we have patients that are based in states in, literally every single state across the US. So hope that maybe this webinar might get you some additional participants, as well as those New York people might be able to participate on your in-person study. You kind of answered it already in terms of saying you opened the second one back up exclusively for chronic Lyme patients, but I was curious overall about what percentage of your practice or either of these two studies are really made up of chronic Lyme patients.
So in terms of the studies, these two studies, the first study is split evenly between the three cohorts that I spoke about. So we're going to recruit 30 people with chronic Lyme, 30 people with ME/CFS, 30 people with LongCovid. Which I just think more of these cross condition studies need to be conducted so we can understand similarities and differences. The second study, the Sinai Health study, will be exclusively Lyme. So we're very excited about that as well. Where as clinical demand for services at the clinic continue to increase for chronic Lyme disease, we're really planning to ramp up our research efforts. So definitely watch this space, and you know, I'll definitely keep in touch with Project Lyme as we explore other clinical trials that we can potentially bring to the community. There's a lot we can be doing, and you know, we're really excited to get out there and try.
Yeah, that's really amazing. I have actually from our audience a question specifically about the first one, and please bear with me because as I try to you obviously know the it was what brand of Lumrocaness are you using as a part of the polybio study?
Yes, so we will be using the Beloki lumrocanase yeah, supplement. So it's a bit of a mouthful. However, you that sentence is a bit of a mouthful. However you slice it, but yeah, the company is a Canadian group, and you know, when we do supplement clinical trials, it's very important that we're able to understand and the company is able to share exactly what is in the product. And you might find that a lot of supplement companies are actually not willing to share that information. This company was willing to share, and you know, that was what was necessary for us to pass it on to the FDA for the IND exemption that we received, which is when the FDA says, look, you're not doing this clinical trial to say, you know, to tell people to take this medication, and we're not. This is a pilot trial. If the pilot trial goes well, we'll do a larger randomized controlled clinical trial. This is more of a fact-finding exploratory mission. But even just to get that exemption from the FDA, we need to be able to show them hard data about what's in the compound, and so that's the company we're working with.
There's another follow-up question here for that first study, the in-person. Amy asked, how do you specifically test for the microclotting?
Yeah, so it's a great question. We're going to be doing two assessments specifically to give us a sense of vascular health and then blood coagulability. The first assessment is we're using a device called the EndoPat. This is one of the only FDA-approved endothelial function testing devices that's out there. Endothelium is just the fancy term for the inside of our blood vessels. And so the EndoPat gives us a objective marker of blood vessel health, which we can use to sort of look at changes before and after using the supplement. The other marker that we're using is we're working with a device called the SonoClot, SONO clot. And this is a blood biomarker of coagulability that is extremely sensitive and has been used in other studies that sort of dose supplements such as nattokinase, lumrocanase, and even some anticoagulants. And so we're going to be using that. We'll also be storing some blood for microclot analysis using methodology from Riccia Pretorius and her team. But I'm going to be a little bit cagey about that particular measure because we're trying to move away from microscopy, fluorescence microscopy, which is where we stain the blood and we look at it under a microscope. That's a fine way of identifying if someone has clots or doesn't have clots, but it's not necessarily the most objective way of saying you have more clots than this person. So what we'd like to do is actually use a more accurate technique, which is in development right now, called flow cytometry, where we can actually objectively count the number of clots that's in a sample. So those are sort of the, I'll say 2.5 methods that we'll be using to measure the amount of microclots objectively in participants.
Awesome. That was a great question, Amy. Thank you for submitting that. I have a question on the second study that you're running from Kathy of basically, I guess, a marker of whether or not you can participate. How are you determining the baseline of chronic neuropathic pain?
Yes. So, great question. We're going to be doing a couple of things. So the first thing that we will do is we're going to be using a questionnaire called the SLANS, which S-LANSS. This is a well-validated questionnaire that can differentiate between non-neuropathic and neuropathic pain. So everyone who has pain can come in and they can answer questions on the SLANs. And then the SLANs will really sort of differentiate out, yeah, you know what, we actually really believe that your pain is of a neuropathic origin. Whereas, in other cases, your pain may be of an inflammatory origin or of something else, because as many folks in this audience may know, that often we see Lyme-related arthritis, and it's inflammatory, and no amount of putting a headset on and zoning out is going to change the fact that your knee is inflamed. And so we're really trying to target neuropathic pain, and the SLANS is going to help us to identify that. Then we're going to conduct another evaluation called the neuropathic symptom inventory. And what that questionnaire does is it allows us to see the sort of severity and type of symptoms that you're experiencing. The only thing that we want to make sure is that your pain levels are over a certain threshold to allow you to participate in the trial, because very simply, in pain clinical trials, if you're rating your pain at like a 1 out of 10 and your pain goes down to a 0 out of 10, that sometimes, most of our pain scales aren't sensitive enough to register that as a meaningful change. So we usually want people to at least, it sounds a bit funny that we want people to experience a certain amount of pain, but for clinical reasons, clinical trial reasons, we usually want, above a 3 or above a 4 out of 10, so that we can actually notice change if it occurs.
That makes a lot of sense, and I thank you, Kathy, for putting that question in. I will briefly state that if anybody has any additional questions specific to Dr. Putrino's studies, please submit them now. I'm going to briefly address a couple of the other questions that were in that were not specifically related. The first is, I saw somebody ask a question around if there's any studies actively occurring that are looking into LongCovid patients being directly investigated for Lyme and co-infections. I do know that there's actually a doctor that we've worked with and done a webinar with named Dr. Bruce Patterson. I would recommend you look it up on our website, who is actively recruiting for a study that's looking into the relationship between those patients and is taking LongCovid patients and doing some clinical assessments and other assessments of them for potential Lyme and co-infections. So great question. I don't think it's relevant for this webinar, but please check it out on our website, unless Dr. Putrino, you have anything to add.
I would just add, if folks are in the Boston area, I do know that Miki Tal out of MIT is collaborating with Akiko Iwasaki to collect a cohort of folks with chronic Lyme disease to compare to the LongCovid cohort that we shared with Akiko for the MyLC clinical trial, as well as the cohort of folks with ME/CFS that we have a pre-2020 ME/CFS that we've also sent to Akiko's team. So if you're in the Boston area, reaching out to Miki Tal's lab is probably a good idea.
Awesome. Thank you for that note. I didn't realize that. So I'll have to make sure that I look into that a little bit more in case anybody else poses that question. I saw a couple of requests for the link to the trials. I already put it in the chat, but I'm going to drop it again. That link takes you to our website, which is the event page. On that event page, under the tab about the event, there's the link to both flyers for the Lumbro and the Santa Lyme trials. So look into those and you'll be able to get all the information you need to be able to submit yourself for participation. I already saw that there's a couple of people who are very interested in getting involved. So hopefully you can increase your numbers as a result. Let me look through. One other is, will the recording be shared? Yes. All of you who have signed up for tonight's webinar, this is actively being recorded right now. It's going to go on YouTube and you'll receive the link sometime in the morning. And then let's see, it looks like we had. So this is from Jennifer, basically regarding her existing treatment and if she would still be eligible. Can somebody be actively on antibiotics, whether it's a standard, course or some sort of like an IV pulse, and still be eligible for these studies?
I would say what we try to shoot for in including people with complex chronic illness in any of our clinical trials is we try to aim for stability of treatment. So if your treatment isn't changing anytime soon, we can bring you into the trial. If your treatment is constantly changing, and so I would say that if you're in the middle of like an antibiotic pulse, it might be a little bit difficult for us because your symptoms may be changing, and we won't be able to know if it's as a result of the antibiotics that you're taking or the intervention that we're trialing. So again, my sort of roundabout way of answering that question, because usually we sort of discuss it with a participant, a prospective participant, on a case-by-case basis, is if you're like sitting on a level of doxy or dapsone or something like that, and you're not changing the dosage very much, and your symptoms are pretty stable, we will absolutely bring you in. But if you're alternating your medication dosage and your symptoms are fluctuating and you're herxing and so on and so forth, as you might imagine, symptom stability is something that we're trying to manage for clinical trials, so that we can see changes and link those changes to the to what we're doing. So we would be more than happy to have a conversation with anyone who emails to see if you could fit criteria, and if not, if we could either just find a different way to get you into other trials, or link you to the therapy directly for you to try on your own, outside of the auspices of a clinical trial.
Awesome. Thank you for sharing that information. I think that was a very helpful question, because there are definitely a lot of patients who are actively treating who would still love to obviously get involved. So I believe that's all the questions that we had for tonight that seem to be directly related to your existing studies, Dr. Putrino. So there's a couple of nice things that were said in here. Angela said she wanted to express a tremendous amount of gratitude for all the work that you're doing. And John said, love the work you're doing. Fantastic. So thank you so much, Dr. Putrino, for spending about a half an hour with us tonight and talking a little bit more about your trials. I hope, as I said, that you receive some additional people submitting for being involved. And just thank you again for all of your work.
Oh, thank you everyone for coming, and I really appreciate the webinar. Thank you.
Yep. Have a good rest of your night. Bye-bye.